I initially got into medicine because I wanted to help people, and I was able to tie in my passion for the central nervous system, be able to provide that care to the patients in the community and elsewhere. So I practice neuroradiology. Neuroradiologists primarily use CT and MRI imaging modalities to look at the brain, head and neck, and spine. Patients present with a wide variety of complaints involving the brain and central nervous system. Some of the routine procedures that we perform are lumbar punctures and myelograms of the spine. They're routine procedures that are minimally invasive, and they help us diagnose conditions of the central nervous system. Our job is to make patients comfortable and make them feel at ease, and to let them know step by step what's going to be happening during their day with either imaging or minimally invasive procedures. Before procedures, we'll have a discussion about what's going to happen. We'll walk through it step by step. The procedures that we do are minimally invasive. They're not painful. We do them routinely, and patients have very good outcomes. We have the great fortune of seeing a number of patients through our work as diagnostic neuroradiologists. Because patients seek out care at the Cleveland Clinic, we're able to provide answers that were unable to be attained at other institutions. The thing that makes this the most rewarding to me is being able to use my knowledge of neuroanatomy and neuropathology to truly help patients and help the entire clinical team that's taking care of the patient for the best possible outcome. So I enjoy working out. I like to do CrossFit, and I like to do Spartan obstacle course races. I grew up in Cleveland. I think it's a wonderful city, and that's ultimately why I decided to raise my family in Cleveland.